Thank you so much for the honor of being here tonight. When I opened up the white nurse bag with a red cross on it. It was filled with a plastic hypodermic, a thermometer, a blood pressure cuff, and a small little white Dixie cup nurse's cap. That was it. I was hooked. The costume, the tools, the idea of helping, of rescuing, of curing had me. There would never be another option with the exception of the fleeting thoughts of being a nun. Did I mention that I was Irish Catholic? Although the religious order certainly fared better in the costume department and the chestnut-sized rosary beads had some cachet, the lack of tools soon caused me to lose interest. Beyond the heroic appeal, I came to realize the profound pleasure of engaging with another human being, of being present. In every way possible, I was destined to be a nurse. I fell in love with the profession, and once I was in, I realized it would be where I would live forever. What's my career path? Serendipity, or maybe alchemy, but never did I expect to spend over a quarter century at Yale. I came here as a graduate student to develop my skills as a surgical clinical nurse specialist, and I ended up teaching the newest to come to our profession for 27 years. And I've loved it, almost every minute of it. Each year, I meet the best and the brightest. In each year, they stretch me and they challenge me to dig deeper to help them learn. It was a student, Malia. The year was 1997, and she sparked the idea for Looking is Not Seeing program. She introduced me to the book Zoom. Zoom is all about perception and expanding perspective, and Frida Kahlo. Malia brought up Frida when I was lecturing on multi-trauma. When I told her I had no idea who Frida Kahlo was, the movie had not come out yet, Malia said we needed to go to the Yale Art Gallery, and in a matter of hours, I was standing in front of one of her self-portraits. Frida depicted brokenness, pain, anguish, and force-feeding. In being led through this small, seemingly insignificant but interesting event, I had a revelation. Clinical examination begins with observing, with seeing. Only students and providers often miss cues because they're too busy looking for one problem or focusing on one pathology, typically that's associated with their specialty, and they ignore the entire palette of the patient's corpus. In learning to perform scientific discourse, we often risk reducing our patients and our practice, our way of seeing and looking. We see subjects as a complex series of systems that involves valves and blood and surface and imaging, and we forget about the wealth of things that we can see and sense. With this 18th century painting, we work with our students, compile facts, name what you see objectively, do a visual inventory of the piece. What do you see here? A couple of couples, a kitten, a child, a hand that's stretching out. Is it stretching out or is it pulling back? What of that woman's expression and the kitten's paw? We strain. Do you see the fire? Further confirmation. Yes. Do you see the bloody finger? Each year we turn to our students pressing. What is the theme in this painting? And eventually someone will hush their impulse and they'll shout, touch. It's about touch. Although this example is leading you to a very concrete answer, much of Looking is Not Seeing fosters sensitivity to the more inscrutable, unclassified signs and symptoms that we might have some access to if we spent some time deep seeing. To demonstrate how this sign translates into clinical medical field, I bring you now to a patient's hospital room, to this gentleman. Help me compile clues. Do you notice the clean bed? Why? Because he can't sleep flat. Do you notice the can of nutrition on the side table? Why? Because breathing has become work and work uses energy. Look at his position. Do you notice the pillows? Do you see how his lips are pursed? They tell us he has lung pathology. But what else do you see? I want you to notice the absence of things as well. There are no cards here, there are no balloons, there are no flowers in this room, and that should also inform you about this man. Our research in this area reveals statistically significant improvements in students' observational skills. On average, 13 more objective physical assessment findings and more differential diagnoses compared to the control. Human perception is more complex than simple vision, and our study supports the notion that seeing is constructed, and we can help shape the observational skills of our students. And a day at the museum is a perfect opportunity to demonstrate to you as students that all of life and nature can be viewed as a learning experience. So our looking program worked, and that then morphed into a logical extension to me. If artwork improves perception, then what about music to interpret body sounds? So off I went to the School of Music. I looked it up on the Yale website to see who was dean. I made a phone call. I had no idea who at that point Tom Duffy was, who was acting dean. I made an appointment and I waited. I told him I had an idea. I told him I had no music experience with the exception of 5 years of piano lessons, which, trust me, does not count, and I had absolutely no money. He was in. I handed him a stethoscope. I gave him tapes of actual normal and abnormal sounds, and Tom synthesized sounds that mimic actual heart, lung, and bowel sounds. He created visual notational diagrams for each sound's rhythm, articulation, speed, and volume. And for 3 hours every fall semester, my students head to the School of Music. The only difference in our research study is 3 hours at the School of Music. Our findings: interpretation of heart sounds doubles, lung sounds improves by 50%, bowel sounds improved by 75%. What do you understand by this? That when you use others in your courses, in this case music, you improve the perceptive ability of students. It was Hope, another student, who introduced me to reflective practice and narrative writing. Writ large, the practice of narrative or story is to connect to a reader. That connection is joined not so much with the intellect of the reader, but to a sense of feeling. That's why story is controversial. Feeling, except in psychiatry, is not to be mined in scholarship or science. It needs to be covered over by method, statistics, and objectivity. But story is subjective. And in my experience, I have learned more about my teaching, the process of becoming a nurse practitioner, power dynamics, and our healthcare environment better than any Press Ganey score, exit interview, or course evaluation can provide. Stories may be the perfect vehicle to get at that swampy lowland of clinical practice that is so often disconnected from the rigor of scientific method, where it appears answers and solutions are simply deduced. At Yale School of Nursing, we celebrate this form of narrative knowing. So what are the lessons? I have been immersed in a primordial soup of creativity, risk-taking, and intellect, and that's a lesson. Surround yourself, and if at all possible, with really nice, bright people, and listen to them. Don't limit your knowledge to the narrow path of your already pre-selected science or art. I'm certainly not the first person tonight to tell you that when you merge art and science, magic happens. And I've shown you that magic can have an N, a p-value, grants, and publications. So open yourself up to another. Innovation will only come when a new set of eyes looks at problems, not sameness. Linda Freelander taught me deep seeing. Tom Duffy taught me about music. Richard Seltzer and Donna Deers taught me about narrative. And because of them, my world view opened, and my students did as well. So be creative. Have some tenacity. Risk. My final, more recent revelation is this. The privilege of being at Yale, like so many privileges, brings about a potential distortion in your personal view of yourself, and almost inevitably in how others view you. So I'd encourage you not to buy your own press. It's all smoke and mirrors, and at the end of the day, my mother would say to me, God isn't going to ask you for your CV, Linda. So for God's sake, build a life. You're here as a student, you blink, and I promise you, the next thing you know, you're nearly 60.